Healing Trauma, Understanding Therapy, Overcoming Emotional Pain, and Moving Forward. Written by Grace Rowan. Narrated by Bennett and Fabian Blackwood.
Introduction. When the therapist tries harder than the client, it's not therapy, a well-known psychologist once said. When asked to reflect on the attributes of clients who succeeded the most in therapy, most therapists will happily answer, motivated and active, straight off the bat. Every client who comes to therapy is motivated in some way. However, other clients appear to be motivated, but not as committed to the therapeutic process. Understanding what it means to be active in the therapy process begins with a basic understanding of what therapy is and how it works. While a complete examination of this is beyond the scope of this book, let us look at one part of it together. Every individual is motivated and directed in life by a variety of human motivations. These innate motivations include the desire for connection and the need for significance. They want to feel satisfied and proud of who you are, as well as the need to grow and aim for more, are two more powerful and at the same time contradictory impulses. Life is a process of searching, negotiating, and occasionally dancing among many competing motivations. The trickiest aspect of this endeavor is regulating the tension between all these contradictory impulses to remain the same and get better. At every level of life, one feels compelled to sit back and do nothing, as if one has reached a point of accomplishment and achievement. At the same time, you feel energized to go on a new adventure. When something happens that is both too painful to accept and too powerful to overcome, it is easy to get stuck, as both of these impulses are no longer active. As a result, you have a feeling of impotence or inadequacy. It is too difficult to enable his drive to remain unchanged, to persuade you to accept the situation, since it is too painful. On the other hand, your desire to grow and change does not compel you at that time, because it is too big and overwhelming. As a result, you get stuck. A person has only two options when confronted with a psychologically hard situation like this. He may either lose all motivation and shut down emotionally, or he may try to put off accepting his reality in a frantic bid to keep his motivation.
Sample complete. Ready to continue?